how did you find out about board recognition, and what sparked your interest to pursue this process?
I've always kind of had an interest in stuttering therapy when I was doing graduate school, and I was a returning mature graduate student, so I had taken time off, had my family, and went back. And then I got away from it because I didn't get a lot of background, solid foundation in stuttering and stuff like that. Started out my own private practice with two other ladies, and we worked with preschool kids and early intervention kids. Found that there was really a need for fluency. A lot of the speech pathologists from where I come from are scared to touch fluency.
Yeah.
So then Dr. Yaris came to Rochester to do a seminar, and I decided to be very bold, and I went up to him and I said, I would like to learn more about this, and I want to start a stuttering clinic in Syracuse. And he didn't bat an eye. He said the first step for you to do would be to become a board-recognized specialist. And I said, what's that?
Yeah.
Because I had
College
no
response.
clue. Yeah, I did not know that something like that existed. And he's been great since. He's my mentor, and he's walked me through the process, and I'm about halfway through it.
So how has getting the CEUs been, like, how has that benefited you? Have you enjoyed it? Has it been really challenging to obtain in the area of stuttering?
It's been very educational. I have learned a lot, more than what I did in my classroom in my graduate school.
Mm-hmm. Which was what? What type of exposure to stuttering did you get in grad school?
We had a week of stuttering class, and then we, of course, had the clinic where I did the diagnostic. And this was 10 years ago, and it was all indirect, and that line of thought for young kids. And then Dr. Yaris came and said, well, we're not doing that anymore. So it was really nice to kind of seek out the opportunity to learn about this, and I think I'm so far ahead now than when I started in January. Yeah, and the confidence that, okay, now I do have that knowledge base and that I can go out and practice.
Any advice or words of encouragement that you'd want to give to other speech pathologists that are thinking of going for board recognition or beginning the process of board recognition, that it may seem kind of overwhelming, or like, where do I begin in that, or should I, or can I really do that?
Right.
What would be your words of advice to them?
I think it's the best thing that anybody can do if they're interested in an area. And they have these for all areas, but I think it is the best thing you can do because you learn a lot. Does it seem overwhelming sometimes? Yes, it does. But as one of your clients said, you take it as a challenge, and it's not a difficult thing to do, and you do one thing at a time, and that's how I feel like I'll do one credit hour at a time. Some observation hours at a time, and then if you put them in pieces like that, it's not that bad. And because you want to do it, it's enjoyable, and you kind of can see and put in practice what you learn. And you have to do it so you benefit from it, not because you want those letters behind your name, but because you want to be that effective clinician that you're talking about. So.